Hello everyone, I am urologist Omar Erdamakaya. Today we will talk about scientific studies on patients who do not benefit despite using drugs such as Cialis and Viagra, which we call PDE5 inhibitors. There is a new study. A study conducted in the Far East. In the study, along with shock wave therapy, they also used vacuum pump devices in patients. And they obviously got good results. When they used the shock wave device together with the vacuum pump device at the same time, they achieved a better result than the result they got with both of them individually. They increased the chance of success. Why? Because the vacuum pump device increases the blood supply to the penis and provides rehabilitation in the penis. It provides an improvement in smooth muscle cells. As a result, you fill the tissue with blood. You fill the tissue with blood much more than normal. The shock wave device already provides regeneration of smooth muscle cells. It contributes to the blood flow to the penis with formation of new vessels. They designed the study as follows. They gave shock wave device treatment to one group. They gave a vacuum pump device to another group. They started PDE5 inhibitors in both groups. So they started Cialis in both groups. In the third group, they started both vacuum pump device and shock wave therapy. They also started PDE5 inhibitor in patients. As a result, the group that received both was much more advantageous than the group that received only the vacuum pump device or only the shock wave device. In other words, when both the vacuum pump device and the shock wave device were used at the same time, a more successful result was obtained. In other words, the two were able to create a synergistic structure. There were videos I made before about the vacuum pump device, friends. You can watch them here. The vacuum pump device is a device that has a simple logic and has been used in erectile dysfunction for a very long time. How does the vacuum pump device work? Imagine a fan, a tubular fan. I already have it in my videos. You put the penis in it, so that no air escapes. It has an apparatus. You apply negative pressure. When you apply negative pressure, the penis is forced to fill with blood and has to harden. Even before the PDE5 inhibitors, this device was used for a long time for erectile dysfunction and sexual intercourse. After the penis is filled with blood, another rubber is placed on it to prevent the blood of the penis from escaping back. After preventing the blood from escaping back, the patient can achieve an erection and have intercourse. In this way, there was a satisfaction rate of 66% to 70% with the vacuum pump device. As a result, it was a simple treatment. A really simple treatment before PDE5 inhibitors or in patients who do not have the opportunity for penile prosthesis. As a result, the vacuum pump device is very cheap. It is sold for 500 liras to 1000 liras on the internet, which works manually. How to use the pump device actually needs to be explained thoroughly. Because if the person is used incorrectly, if it is used for a long time, it can damage the penis. Here in my own clinic, I make a significant part of the patients I do shock wave, especially patients with advanced erectile dysfunction, by a vacuum pump device. I explain to the patient how to use it well. We also use the vacuum pump device especially in patients with Peyronie's disease. Or in patients who have undergone an operation for prostate cancer such as radical prostatectomy and have shrinkage in their penis, I make the patients use the vacuum pump device again, both to prevent penis shrinkage and to rehabilitate the penis. We also use the vacuum pump device together with the shock wave device. If we do stem cell therapy or shock wave therapy or Botox treatment, I recommend the vacuum pump device in the same way, friends. Regardless of the degree of erectile dysfunction, the vacuum pump device provides an erection in the patient, friends. Because this is not a situation related to arousal, the patient's organs or the functions of the organs. The logic of the vacuum pump device is already completely based on negative pressure. Even if the patient's erectile dysfunction is advanced, there is no situation such as not providing an erection in the vacuum pump device. Because negative pressure occurs. Seeing that the patient achieves that erection makes the patient a little pleased and happy, friends. As I said, that's why I definitely use the vacuum pump device not only in mild, but also in those with moderate and severe erectile dysfunction. Generally in this way. Thank you for listening, best regards.